New survey out revealing that Ontario's registered practical nurses are facing unsustainable conditions amid ongoing staffing shortages. The Registered Practical Nurses Association of Ontario, also known as WeRPN, the professional voice of RPNs across the province, released these findings from their annual survey titled The State of Nursing in Ontario, a 2024 review. Joining me right now to discuss is the Chief Strategy Officer of WeRPN, Tiff Blair. How are you today?
I'm great. Thanks for having me.
Thank you so much for joining me here. So, right off the bat, what are some of the threats of our healthcare system right now that we're facing?
Yeah, well, I think we've been doing this survey for the last 4 years since the pandemic, just to see sort of the state of healthcare and the state of nursing in particular. So this year, our findings really showed that the nursing shortage is continuing to have an impact on both nurses and patients. We're seeing nearly half of RPNs considering leaving the profession. We're seeing 78% talking about they are being directly impacted by the nursing shortage, and 91% of them saying that that's having an impact on the quality of care that they're able to provide for patients. And we're also seeing the mental toll that it's taking on those nurses themselves. So, I think that there have been some improvements in some areas, but there's still a lot of work to do to get back to optimal levels.
Those are some pretty staggering statistics there. Why is it that 50% are thinking of leaving the industry?
So I think it's a few different things. So certainly one, the nature of the workload and how it's just grown over the last number of years. I think, obviously nursing has never been a stress-free profession, but I think since the pandemic, it's really gotten to a point that we're asking nurses to work beyond what's reasonable, and then I think that's taking a toll on them personally. I think we hear from a lot of nurses that, go into work wanting to provide the best care possible to their patients. Obviously, that's why they got into the profession, and then leaving at the end of the day feeling like a failure because they weren't able to provide the care that they know that their patients or residents deserve. And I think you get to a certain point where it really takes a toll, a personal toll. I think the other thing, particularly for RPNs, there's a financial consideration as well. So RPNs have historically faced quite a bit of wage compression, meaning that, compared to some of their registered nurse colleagues, they're paid quite a bit less. So we've seen in the last number of years that I think a number of them have found that, the pressure is just too much given how they're compensated.
So how has it been, I suppose, since COVID hit? Like, has there been a significant loss already of RPNs from the system?
Yeah. So when we look at the College of Nurses, they keep track of how many nurses are registered in the province. And we used to have, the RPN category used to be growing year over year. And this year we're actually seeing about 500 less RPNs registered in the province compared to this time last year, at a time when we know that we need more of these nurses. So I think there have been, efforts to recruit more nurses. There have been new spaces opened in schools, but I think we're seeing the toll of really those people choosing to leave the profession, and the impact that it's having on the nursing workforce.
So it's overly more concerning then that with 1 and 2 considering leaving, that's a problem in and of itself. But at a time when you're already losing, it's a really staggering figure.
Yeah, for sure. I mean, we've seen, so as I mentioned, we've been doing these surveys for the last number of years. Last year, we saw 2/3 considering leaving. So now that number is 1 in 2. So, I mean, I think that there has been some modest improvement, and maybe some conditions are changing, which are making some nurses consider staying in the profession. But there's certainly a lot more that we need to be doing to both continue to recruit more nurses, but also make sure that those experienced nurses who have that knowledge and expertise are staying in the system.
So, we talk here often with people in the healthcare sector on AM 800 CKLW, and one word that I've had described to me often of the situation at hand is it's triage because of the staffing shortages, because of the buildup that occurred from COVID, because of the lack of access. And I guess I would love to get your perspective on just that. Is it still a triage-based system? I say this selfishly because I've been sitting with a broken wrist for the better part of the past 3 years, and I still can't get to see a specialist.
Yeah, I think that's an accurate description of the situation. I mean, I think that we hear a lot from our members about, the workload is just so much that you're trying to provide the necessary care, not necessarily the best care that you can, just because you're trying to ensure that everyone gets a certain standard of care to, provide the basic needs, but not the optimal type of care that you would ideally provide under more optimal circumstances.
It's a tough situation. So, I mean, there's obviously never a silver bullet that can address everything. But when you look at this and you assess it, what would be some of the remedies that you would prescribe?
Yeah, I think there are a few things that, we're calling for government to take action on. So one is the idea of introducing nurse-to-patient ratios and sort of having that legislated. So there are certain other jurisdictions like BC and Australia that have done that and basically said what a minimum nurse-to-patient standard should be in different environments. I think that would be something that would be a key important step to help address sort of the normalization of understaffing, which we're seeing now. I'd say another thing would be around the wage issue that I mentioned before. So there have been some minor improvements since Bill 124 was squashed last year. Unions have been able to negotiate improved wages for RPNs in some sectors like hospitals, but there's a lot of work environments like long-term care, home and community care, where wages are falling behind. So people, it's really hard to recruit nurses to those areas because when they're comparing, I could be making $34 an hour in a hospital, or I could be making $22 in home care, and thinking about, the impact on their finances, it's harder to recruit people to those sort of more historically underpaid areas. And then I think, streamlining educational opportunities would be a third thing I'd highlight. There are, as you mentioned, more spaces in nursing programs, but right now it's quite difficult to access those, and I think growing that pool of nursing educational opportunities is a key way that we can help grow the nursing population when we need it.
Well, it's something that impacts all of us in one way or another. We're going to keep our eyes on this one. I want to thank you so much, Tiff, for joining me to talk about this.
Oh, thanks so much for having me. Really appreciate it.
Have a great weekend. Tiff Blair is the Chief Strategy Officer of WeRPN.